Well, sleep requirements do change constantly with the age of the infant or child. For example, a newborn will need about 16 to 17 hours of sleep. And by the time they are teenagers, the sleep need will come down to about 9.5 hours. So it does gradually decrease over time. But in general, I would say that a person needs that much amount of sleep, which will help them wake up in the morning feeling refreshed, assuming they don't have any other sleep disorder with them. If we're talking about infants, for example, it's nice to make sure that the child is placed in the crib with the face up, not face down, but face up, and that there is a fairly set schedule. One has to be careful in terms of avoiding overfeeding, because if the baby wakes up at night, it's not always that they are hungry. Sometimes they may be simply wet, etc. So monitoring that aspect of their feeding is important. I think for toddlers, it's a good idea to have some limits in terms of how long the bedtime stories are. It shouldn't be yet another story, yet another glass of milk. Because sometimes toddlers have a habit of prolonging their interaction with their parents for over an hour or two. So I think keeping the bedtime routines and scenarios a reasonable limit, 20-30 minutes is good, but it shouldn't really go on and on and on. And I think for toddlers, it's also a good idea for the parent to actually leave the room before the child actually falls asleep. So that we are actually training the child to learn independent sleeping habits. So in order for that to happen, after the goodnight kiss, after tucking them in, the parents should really just leave the room. So that's very important to do. And then, of course, for school-age kids, these days, we have television sets in the bedrooms, we have computers, we have cell phones. I think that these devices should be stopped, the use of these, perhaps about a half hour to an hour before actual sleep onset time. So the child is expected to go to sleep, say, by about 10 o'clock, then by about 9 o'clock, I think we should pack all these devices up. It's probably not a good idea to leave them in the bedroom because they will still ding. The message comes. So I think it's a good idea to leave the cell phone on the kitchen counter, I would say. And so these few points also apply to teenagers. But in addition, I think teenagers, one has to be careful that they really don't spend Friday night and Saturday night staying up late, like 3 or 4 in the morning, because then they will have a really hard time waking up on a timely basis Monday morning. So that's important. Exercise is probably the best counter strategy for preventing daytime sleepiness. And I think modest degree of exercise 4 or 5 days a week it will certainly help children stay alert during the day. And if they exercise during the day, they will probably have a better night of sleep as well. When the schools quit for the summer, they're starting their summer break, I think it's a good idea not to let the child sleep in till 10 a.m., 11 a.m. I think I would make sure that the child does wake up by about 8:30 or 9. That way, when school is resuming in fall, the degree of change that we're asking in the sleep schedule is not that much. But I think it would be a good idea, perhaps, to shift back the morning wake-up time by about a half hour every 2-3 days. For example, if right now the child is waking up at 10 a.m., next 3 days say, okay, you should wake up at 9:30, then after 2-3 days maybe wake up at 9, then moving backwards like that till perhaps we come to a time around 6:30 or so, and then trying to stick with that. Now, when the child starts doing this, obviously, I provided we make sure that they don't take any daytime naps, because you don't want, if they're waking up early, the tendency might be to make up for that by taking a daytime nap. He said, no, try to stay awake during the day, go out, play in the sunlight, exercise, and if you do that, I think the child will gradually start falling asleep earlier at night as well. So block the morning wake-up time, or move it back gradually, step by step, prevent any daytime napping, and that should work. So I think there are, for example, we talk about memory, and there is very good evidence now that the consolidation of memory happens after a good night of sleep. By consolidation, I mean that it sort of becomes, facts become firmly ingrained in our minds, and we're able to pull them out the next day. So for consolidation of memory to occur, it's important that the child have a good night of sleep. So if they may learn a variety of facts at school, but if they have not had a proper night of sleep, the next day they are going to have a hard time remembering those points of information. The other areas of research also point to the fact that when it comes to daytime attention and concentration and what we call executive function, those are also related to having a good night of sleep. So the ability to plan a project in one's mind, initiate it, correct for mistakes midstream, and then see that task through to completion. All of that also is to some extent dependent upon having a good night of sleep. Then if you look at moods, we know that children who have not had a good night of sleep, the next day they are likely to be irritable, they may have a short fuse, and maybe even more prone to accidents. So all of those aspects of behavior, memory, learning are linked to good sleep. And then if you look at the other end of childhood, infancy, and early childhood, we know that babies indeed do grow in sleep. If you look at hormones like growth hormone, which is secreted, which really enables body growth, that is secreted largely during sleep, deep sleep. So I think it's important for babies to have a good night of sleep as well.